Hi, I am Dr. Naveen Tahasildar. I am spine surgeon working at Narayana Orthopedic Spine and Trauma Care Center. We're going to talk about cervical disc prolapse and other cervical problems. So, cervical disc prolapse is common in the population. The most common symptoms are neck pain and neck pain that can radiate down, that is passing down the hand. So this problem, whenever it comes, the high risk group are basically people who work as a sedentary. They are working on the laptop or on the keyboard on the system, or some people who are lifting heavy weights. So whenever there's this problem, neck pain coming down the hand, we need to do an MRI to look at the diagnosis, how much pressure is there on the nerve. The cervical disc prolapse especially can be managed non-operatively, that is conservatively with medications. Sometimes we have to give them a short course of steroid. 90 to 95% of them wouldn't require a surgery. But if these people do not have a good relief in pain at the end of 3 to 6 weeks, they become candidates for surgery. The most common surgery which is done for these conditions is an anterior cervical discectomy and fusion, or we can also do artificial disc replacement for these patients to basically decompress the nerves and then stabilize the spine or replace the disc so that they can regain the movement. The results of the surgery are good. We use the microscope to decompress the nerves, and we also use the minimally invasive gadgets that we have. We do a very small cut, which is a horizontal cut. You don't see the scar as often. And cervical tumors or cervical infections can also be managed in a similar way, and we have been having good results with it.